On behalf of the Health Equity Partnership of North Central Massachusetts, along with our partners at AARP and Community Education Services, we would like to thank you for attending today's webinar. This Quick Start webinar will introduce you to the key features of the MyChart patient portal. You will learn how to create a patient portal username and password, log into the portal, check test results online, communicate with your care providers through the portal, and attend virtual appointments. By the end of this session, you will have these foundational skills necessary to effectively use the MyChart patient portal. In this webinar, we will cover the 3 most common ways to use a telehealth platform. We will explain that telehealth platforms consist of 2 applications and demonstrate how to enroll in a patient portal, such as MyChart, using various methods. Additionally, we will showcase the basic features of MyChart and explore many other useful functionalities. Before we dive into telehealth platforms, let's take a quick look at what they're commonly used for and what basic parts they're made of. Telehealth platforms, such as MyChart, have revolutionized how we access and manage our healthcare. They provide a comprehensive and connected healthcare experience, leading to improved health outcomes and an enhanced quality of life. The 3 most common ways we can utilize patient portals are: 1. Online access to medical records, including medical test results and doctor's letters. 2. Secure and timely communication with care providers for non-urgent medical issues. And 3. Convenience of real-time virtual appointments that are secure and accessible. Telehealth platforms are 2 apps. The first app is a patient portal, such as MyChart, which lets patients access their healthcare online and join virtual appointments. The second is a communication app, with Zoom being one of the most popular for virtual appointments. In Massachusetts, many large health systems have adopted Epic as their electronic health records platform. Many of the largest hospital networks have migrated their entire systems to Epic. For these organizations, Epic standardization has been a strategic internal goal to improve efficiency and consolidate patient records across their own facilities. MyChart is Epic's user interface that allows patients to securely access their online medical records, schedule appointments, communicate with care providers, and attend virtual appointments. In other words, MyChart is the patient portal powered by Epic. Each health system in Massachusetts has its own unique patient portal. Fortunately, telehealth platforms that use Epic and MyChart have significant similarities. For example, patient portals provided by Mass General, Beth Israel Lahey Hospital, UMass Memorial, and South Coast Health use Epic as the electronic health record system and MyChart user interface. Therefore, you can expect their patient portals to have a comparable appearance and functionality. Before you can enroll in your telehealth portal, you need to obtain a link or an activation code from your care provider. To enroll in MyChart with an activation code, go directly to the patient portal website and click Enroll Now. Step 1. Enter your activation code and date of birth, then click Next. Step 2. Set up 2-step verification. This is an important security feature to protect your health information. In addition to entering your password, you'll enter a temporary code sent directly to you by email or text. You can only log into MyChart with both pieces of information. This means that even someone with your password cannot access your health information. Click Continue to turn on 2-step verification. If you have a link from your provider, you can enroll and create a username and password by following these steps. Step 1. Click on the link provided by your doctor's office in a text or email. This will take you to a sign-up screen. Step 2. Once on the sign-up screen, your email will be presented as your username. You have the option to change it if you prefer. Step 3. Create a unique password that is at least 8 characters long. Your password must include at least one number, one uppercase letter, and one special character. Step 4. Enter your date of birth and then click Submit. Step 5. On the next screen, review the terms of use and click Accept. You are now enrolled and logged into MyChart. Step 3. Start the process to verify your identity. You will see the email address we already have on file for you. Please add a mobile phone number if you have one, then click Continue. Step 4. Continue to verify your identity. Here, you request a one-time code. You can click Send to my email or Text to my phone. If you click Send to my email, open your email in another browser tab or window or on another device. Keep this tab open. You will need it to enter the security code in the next step. On the next screen, enter the code you received. Letters can be entered as uppercase or lowercase. If you haven't received a code, click Resend Code before you click Verify. Notice that you can choose to select Skip this step next time. That allows you to skip two-step verification for 90 days as long as you are logging in from the same computer or mobile device. Step 5. Enter the code and click Verify. On the next screen, you can update your email address and enable text. Notifications if you choose to enter your mobile phone number. This information is not shared with anyone. Then click Sign In. You can sign in with the username and password that you learned how to set up at the beginning of this video. On the next screen, review the terms of use and click Accept. You are now logged into MyChart. In this section, we will demonstrate features in the MyChart patient portal. Welcome to MyChart. Here, you can access and share your medical records, schedule appointments, refill your prescriptions, and much more. I'll give you a quick tour of some of the most exciting features. Let's get started. First, it's important to know that you can access your medical records in MyChart whether you're using the web or a mobile device. While I'll show you features from the web, you can expect a similar experience on your phone or tablet. Log in using your username and password. Once you log in, you see the most relevant updates and details about your health. There's a lot you can do in MyChart. Your health feed is the place to find things like new messages, payments due, and preventative care. Looks like it's time for your flu shot. MyChart will remind you of any preventative care, and you can schedule, snooze, or dismiss them in a few clicks. You and your care team can directly communicate using secure MyChart messaging. You can get an email or text to notify you when you have a new message in MyChart. But no matter what, responses appear in your health feed and then open in an easy-to-read chat format. Go to your message center to view all previous messages or send a new one. When you choose to send a new one, you're given a list of options to make sure that your request goes to the right place. Select the option that best describes what you'd like to message about. Sometimes you can take care of things like making an appointment or refilling prescriptions without messaging and waiting for the response. To view your recent and upcoming visits or schedule a new one, use the Visits activity. Check out your after-visit summaries to see the details of a past visit. Often called an AVS, it includes your medication instructions and any other important notes from the visit. From MyChart, it's simple to schedule a visit. Let's say your doctor wants you to schedule a follow-up in a couple weeks. Click here or search for Schedule in the menu. Then, the Schedule section shows you the appointments you need to schedule, including that follow-up visit. You just click Schedule and pick the time that works best for you. After it's scheduled, add it to your calendar So you don't forget, if you want to be notified if an earlier appointment becomes available, get on the wait list. Save time at the clinic by completing e-check-in before your visit. When it gets close to your visit, you can get a notification with a reminder and link to check in. Update your demographics, add any insurance info, sign relevant documents, and more. You can even pay in advance. If you have a copay due or a previous balance, you can handle it right here. Some visits may even have an estimate attached, so there won't be any surprises when you get to the clinic. You can view its details by clicking here to jump to the estimates activity. After the visit, you don't need to wait for a phone call or a letter in the mail with test results. MyChart notifies you as soon as they're available. View the results to see your findings or values and whether the results are within the normal range. From here, view a graph of past results to see how they've changed over time. A full list of your results appears on your test results page. Let's take a peek at the medications activity. You can see all of your active medications. Be sure to remove any meds you're no longer taking. You can also request refills on a single medication or multiple meds at once. Moving on, let's say you just moved from out of state and want to see information from your old clinic's MyChart. You can use the Link My Accounts page to create a link to your old record so that you can review prior visits, results, and more. To access it, go to the menu, then search for Link My Accounts. On the Discover tab, search for your old clinic. Then set up a link by selecting the Link Account option. You'll be asked to verify your information or enter a username and password to finish setting up the link. Once your accounts are linked, you'll see this icon next to any information that came from another health system. If you need to share your health record, search for Share. From here, you can assign MyChart proxy access to others. Just provide their contact information and what type of access they should have. They'll see your authorized health information when they log into their MyChart. If you have proxy access to another's health record, you can see their information right alongside yours in your health feed. It's organized and color-coded like this. Use the button here to swap between records. Directly release your health data to any provider with internet access, no matter where you are, using Share Everywhere. The provider is sent a one-time code to see your history, medications, allergies, and more. As a patient, one of the most important things you can do is prepare for the unexpected, regardless of your current age or life situation. MyChart can guide you through this using the end-of-life planning activity. I'll search for it from the menu. If a family member, doctor, or other designated healthcare agent needs to act on your behalf, you'll want your preferences clearly documented. Here, you can use a question and answer format to record your decisions and preferences for medical and end-of-life care, and you can request a visit with care coordinators to discuss these matters further. If you or your care team want to track your health goals or needs, let MyChart be your care companion. Let's say that you're trying to focus on improving your health based on a recent diagnosis. MyChart can remind you of the tasks you need to do each day, like exercising or getting enough sleep. You can also create your own tasks with reminders. Before we go, I want to point out that I've used the menu to search for a few of these activities, but there are so many more available. Your MyChart homepage will highlight features here, but you can also explore what's available from the menu. Virtual appointments have become an essential aspect of modern healthcare, enabling patients to connect with their healthcare providers from anywhere. In this section, we will demonstrate how to prepare for and initiate a virtual appointment using MyChart. To start a virtual appointment, follow these steps. Step 1, log into your MyChart using your username and password. Step 2, from the homepage, click on the Visits button. Step 3, select Appointments and Visits from the drop-down menu, and then select your scheduled virtual visit. Step 4, once the appointment is open and the details of the appointment are visible, click on the orange Begin Virtual Visit button. You will be placed in a virtual waiting room until your provider arrives. When the visit begins, you will be able to see yourself as well as your provider through the application, and you will be able to hear them directly. Your provider will conclude the visit when it is complete, at which point your session will end. Please do not close the session on your computer. Wait until your provider has officially ended the appointment. We hope you enjoyed today's webinar and found the lessons helpful. In today's MyChart Quick Start webinar, we explored the key features of MyChart, powered by Epic. We began the session by examining the 3 most common ways to use patient portals, namely, 1. Access online medical records. 2. Communicate with care providers about non-urgent medical issues. And 3. Attend virtual appointments with care providers. Next, we discussed the 2 components of telehealth platforms: a patient portal app, like MyChart, and a communication app, like Zoom. We learned how large health systems in Massachusetts manage health records using Epic, with MyChart serving as the user interface for accessing patient health records. We then demonstrated how to log into MyChart, view online test results, securely communicate with care providers, consolidate and share information among different care providers, and attend virtual appointments. These foundational skills are essential for effectively using MyChart to create a comprehensive and interconnected healthcare experience, which can lead to improved health outcomes and a better quality of life. Thank you so much for joining us for today's webinar. We really value your feedback and would love to hear your thoughts so we can keep improving our sessions. If you have a moment, please fill out our quick survey. Just click the link in the description below. We'd also welcome any comments you want to share in the comments section.